Hi guys, welcome back to my channel. In today's video, I'm going to share with you 10 common questions that I have gotten that has to do with nursing school. Before I get started, if you guys would please do me a huge favor and give this video a thumbs up and subscribe to my channel. You would make my life, my world. I love you forever. And turn those post notifications on, the little bell up there, so that you know when I'm uploading and I have a new video out for you guys. If you don't know me, my name is Chelsea, and yeah, let's get right into it. The first question I have here is, what areas of nursing do you focus on in nursing school? So the first semester, the first actually summer that I got accepted, and every school might be a little bit different on how they do the order of this, but the summer going in, I did like an intro to psych. We got like all these different, you just learn about like the different stages of life pretty much. And then my first semester was like all fundamentals. It's like learning the lingo and terminology and things like that. The first semester is all fundamentals, so you really just have like a broad idea and get like a basic understanding of nursing and all the different body systems, everything like that. It's very broad though, and it kind of just skims the surface. And then the second half of the first semester, I did intro to pharmacology, so we start learning about all the meds and obviously like what med is used for what and what diseases, things like that. Then over the winter, I had done advanced pharmacology, so it's just like diving deeper, getting a better understanding. Obviously advanced, it kind of has it in the name. And then my second semester, I did psychology and intro to med-surg, which is medical surgical, so it's more advanced with like understanding diseases and like the body systems and like the pathophysiology of kind of what's going on with the body and why certain diseases and things happen to people. Yeah, so they are changing it, at least at my school. They're going to do, for second semester, they're going to have intro to med-surg and then advanced med-surg, which to me makes more sense because then you're just getting like a plethora of information and you're not going like almost a year learning like the intro to a subject and then like the advanced part of that subject. It's just kind of like a little bit too much. To me, it was too much time apart of that. And yeah, so, but anyways, so even in first semester, the first half of it, we did all of our like lab work, so we kind of just got like all of our basic skills, and we had to do our checkoffs of, you know, whatever different skills that we would be doing in the hospital. So we don't get any hospital experience the first half of the first semester. Second half of the first semester, we actually go into the hospital and we start learning how to give medications and different types of skills. So that was very nerve-wracking, but you will get through it. It's not as scary as you think it is. But yeah, and then second semester, obviously I'm going back and forth a little bit, sorry. Second semester, when you're in psych, you go to like a psychiatric hospital, and then med-surg, you go into just a regular hospital, and I was on the telemetry floor. It was just all kind of cardiac issues, so you'll see a lot. And then the following summer I had off, which was great. And then third semester I had, what was it? They split it up. My first half was OB, so I got to see a baby be born. That was amazing. Maybe for the male nurses out there, not their favorite. The males in my class anyways, the guys in my class. OB and peds was, or no, I'm sorry, OB was not their forte exactly, but I loved it. I think maybe down the line I would want to do something like that, but not at the start. But yeah, so I assisted, I helped with a baby be born. That was amazing. And then So we did 4 weeks of OB and then 4 weeks of pediatrics. So, I mean, kind of self-explanatory, we do that. And then the second half was advanced med-surg. So like I was saying, the beginning of the year I had intro to med-surg, and then at the end of the year I had advanced. So it was kind of like, I wish it was put together, but whatever, still passed, got through it. That semester was honestly the hardest for me. It was hard because you go from kind of being cradled the first 2 semesters, and then the 3rd semester they're like really preparing you to be on your own and out in the real world and act as a nurse without really as much, I guess, like cradling help. Like you really have to think for yourself, which is good, but it was like definitely the most difficult because you're expected to know a lot more. Yeah, at that point for us, our instructor had us, every morning we would have to get our patients' information, all of the medications that they were prescribed by 9 o'clock. We would have to know the medication, side effects, nursing interventions, the mechanism of action of the medication, and what am I missing? Oh, like the class of the medication as well. And then like obviously why the patient's getting all of those meds. So it was so nerve-wracking. Every student in my class is like running like a little chicken with their head cut off because it's on a timed basis too. So yeah, that was fun. And then now I'm in my 4th semester, and yeah, we're learning more advanced topics, and it's just more dense. Like all the information, everything's more dense, and it's all kind of like just piecing everything together and coming together. We had like our first major exam was on cardiac, and then our next exam, which I actually had today, was on the lungs, and then we have renal, so the kidneys, and then it's our final exam, so it's just like kind of everything together. So yeah, that's that. And then after this 16 weeks is done, I go into precepting, which then means I will be acting as a nurse, like, and then the registered nurse actually follows me, and they report back to our instructors and say if we're capable of being on our own or we're not. So fingers crossed. Okay, so next question. How much time do you spend studying? For me, I think it varies with everybody, but for me, I've kind of found what works and how much and how little, I guess, like I need to do. At first, I feel like I like read every single word of every single chapter, and it's just like information overload. Like I got really great grades, but I think now I'm more like focused, and I make sure like whatever's talked about in class to like really hone in on that, which helps me with my time management. And I'm working now too, and like there's just a lot more life happening for me. So for me, I think I'll range anywhere from like the week before an exam, I want to say like maybe 10 hours of studying, and like broken up. I think once you're in it and you get through like the first even just like few weeks and like learning how the tests are and really understanding and getting used to that critical thinking, you'll find your groove of what works for you and like how much time you need to spend on what. So what's the lowest grade for passing? For my program, I'm pretty sure it's like pretty universal for most programs, but for mine, 75% is the lowest grade that you can get in a class. Should I question it before? How many times can you fail a in my program, you can technically fail one class and retake it, but if you are failing, which is failing less than, if you're getting less than 75% towards the end, or like if you're borderline, a lot of times teachers will come up to you or they'll have a conversation with you and say, look, like, basically it's not looking good, and they will sometimes recommend that you drop the class instead of fail it, so that you don't have your GPA get like messed up or anything, and then you can retake that class. And it's question 5. Is the nursing schedule of classes set, or can you make your own schedule? So yeah, I don't know how it is with other programs. I'm pretty sure they're all relatively the same, but they are set. So once you're in, they just tell you like exactly what classes you need to sign up for, and you take that, and like you don't have a choice. If you're in, so we have 2 different cohorts, so 2 different sections of our class. So like say there's 40 people within our cohort, 20 will go with one class the first half of the semester, and then we'll switch the second half. So you get whatever schedule's given to you. Okay, and then what inspired you to be a nurse? So I have several family members that are nurses. I have a few of my cousins, some of my best friends, and long story short, I originally went to college under a nursing degree major. Like I was majoring to take nursing, but then I changed my mind and I started working in physical therapy, and then I thought I wanted to be a physical therapist. Ended up getting my bachelor's in kinesiology because I thought that's what I wanted to do, but like halfway through I didn't want to do that anymore, and I was already so close to getting my bachelor's that I just got that and just have another degree. But yeah, I didn't have this like aha moment, and like a lot of people have these moments when, you know, like a loved one is sick or something like that, which is great, and like that inspires them to be a nurse. But like it kind of just was my path. Like I always knew that I wanted to work in something in healthcare, and science was always my favorite subject. I just didn't know exactly what, and yeah, so now my path has led me here, and that's that. Okay, how do you get through overwhelming days? If you're in nursing school, you will have quite a few overwhelming days. I remember my first semester, I was like more often than not like so just incredibly overwhelmed, and I knew like it was only gonna get harder. And to me, I was like, I had so many moments that I was like, I don't know if I can do this, because it's a totally different way of thinking, and you really have to learn how to manage your time, and really have to learn how to like just get shit done. Sorry, like you just like really, it was just a whole different mindset and a whole different way of like learning and doing things, and I think honestly, like after like the initial shock of first semester, you get such an idea of, okay, like this is what I need to expect, and this is what I need to do, and this is what is working for me. And when I'm overwhelmed, like a lot of times I'll just cry, and like flat out, you're gonna cry. If you're in nursing school, you're gonna have one to many moments of crying. It's very stressful, but it is so worth it. I hope I'm not scaring you guys away. It is worth it at the end of the day, but it is very stressful, and I am somebody that like is very affected by stress. So it's okay to cry. I've cried a lot, but other than that, other than just crying, I try to go to the gym and work out and do things that really make me happy. And just sometimes you just need to turn your mind off and really just like disconnect. And like, I am such a reality TV snob. Like, I love my TV shows. I love just like relaxing and lounging and doing just what makes me happy. So if I'm really feeling overwhelmed, a lot of the times if you're there with that like mentality of being so overwhelmed, studying or reading or doing something that is overwhelming is not going to be conducive or helpful to you learning. So it's okay to give yourself some time. I'm still here, I've still passed, I've gotten through it, I'm about to graduate, and I can say that I haven't been like, you know, somebody that had my head in the books 24/7 and, you know, hasn't had a life since nursing school. Like, you work it out. How do you keep a balance? So I was kind of touching on this even in the last question. So I do find it super important for you to have your like me time. So I need my me time. I need my alone time, I guess. Like, I'm not somebody that like really likes to be alone all the time, but I do have a lot of moments, I think, after like a stressful test day or clinicals, like just mentally it takes everything out of you. So I just like I'll go home and like sleep it off for a little bit, and then, but really, like, if I know that I have an exam, like usually it's, you know, the start of the week, if I know I have an exam and say it's like a friend's birthday or something that weekend, or it's some sort of event of something, like, I still want to be there. And I think that I've made a point to be present in the people that are very important to me and close to me in my life while I'm in nursing school, even with such a busy schedule, because I need that too. Not only like I want to be there for my friends, but like I need that time. I cherish my time with my friends and my family and my boyfriend. And if I know that I have an exam or a paper or whatever, I get it done like early. And so that I know, or I get it done before whatever event or hangout or whatever that I have scheduled pretty much in my week. If I know, let's say I have a test on Monday and I have a friend's birthday and it's happening on a Saturday, like, I'm getting my studying done prior to that, and I feel like, you know, pretty confident on the topics and whatnot before that scheduled event, if that makes sense. I don't know. So that's just what's worked for me. I feel like that's what's helped me feel okay and comfortable with having that release and like time that I'm not studying, to like just give yourself your life still. Okay. Let's see. Study tips. So I feel like all my questions are kind of blending together. Sorry guys. But for study tips, I guess, I mean, everybody's obviously different. I have people in my class swear by flashcards, and that works wonders for them. If I know that I have to memorize like certain values or something, like for instance, like lab values, or just anything that is like number related, or like, yeah, just things that you know you have to memorize that won't really change, I'll do on flashcards. But other than that, if it's just if it's concepts, like, I learn it by reading it a little bit. Like, I'm not a major person that learns by reading something. I like to look at a lot of pictures, and there's a lot of YouTube videos, but make sure that you're watching videos that are from reputable sites. But I'm very visual, and a lot of times, like, if I read something in a book, I like to see like the picture of like what's happening, and then also when I see it in the clinical setting, it makes a world difference to me, because I feel like everything starts connecting when you see it. Like, I'm not a very strong reader. I don't like to read in my free time. It's just not something I've ever loved. So to read a book that is medically based and very dense, it's hard for me. And so I think as far as studying goes and like reading tips like that, it's just like read as much as you can. Look at, for me, it's looking at photos in the book and kind of relating it, looking at videos and talking about it. I do like tons of study groups. It's really difficult for me to study on my own. Like I'm a very distracted person, so it's not, studying on my own is not for me. Study groups have saved my life. It has talking about topics and like really understanding, because a lot of times if you don't understand something, if you ask a classmate or if you're in a study group, like maybe they really get it and then they can explain it to you, which is helping them as well, or vice versa. Like maybe they're not understanding a topic and then you have a chance to teach them or talk to them about it. So that's helped me. But you will find me in coffee shops, Coffee Bean, Starbucks. Those are my go-to places to study, and I just zone out. So my last question is, what kind of nurse do you want to be? So I feel like I dabbled on this a little bit. All my questions kind of blended together here and there, but at first, like I said before, I really wanted to get into aesthetics. I thought that's all I wanted to do, and then my teacher last semester, for my third semester, was actually a house supervisor at the hospital that I'm now working at as a nurse assistant, and she recommended me to work there, and we just had this long talk, and she honestly like just opened my eyes to just so many opportunities and learning experiences, and it just really just opened my eyes to all the possibilities that can happen within the hospital as well. And so yeah, I'm really grateful for her, and I'm so thankful that she gave me the opportunity and that I now am working where I'm working, because I love it. I'm like so happy to be a part of the hospital that I'm at, and everyone that I work with alongside are amazing, and they're so helpful and so kind, and I'm happy to be in an environment that is like that. I feel like you don't always get that lucky. So yeah, but I'm in my fourth semester, like I said, and fingers crossed, it's not confirmed yet, but I would love to precept in the ED, so the emergency department. I found a nurse that I love, and she's such a great teacher, and so I'm really hoping that I get her. And I ended up talking to her. I told her that I had an interest in the OR because I love surgery. That's really interesting to me. And then also I potentially had wanted to be a nurse practitioner as well, which is like a step below a doctor. It's very similar to a physician's assistant, a nurse practitioner. So I'm going to have my ADN when I graduate, which is my associate's. And then I'm going to get my BSN online. Once I have my BSN, I'll go from there, or I might just go ADN to my master's, which in nurse practitioner. I'm not, my point is I'm not 100% sure, but there are so many opportunities, and there's so many different areas in nursing that you can go into, which is a huge reason why I chose nursing, because I do change my mind and I find so many different things interesting, and I love just like learning about everything. So I'm excited to be a part of the hospital where I'll have that opportunity to learn new skills and just have a variety of different opportunities that will come my way. But anyways, back to me with my ED nurse. She had actually recommended me to potentially become a CRNA, which is a certified registered nurse anesthetist. So it's like your anesthesiologist, the person that puts you under during surgery, because I expressed that I like the OR and potentially would be a nurse practitioner as well. So she said, she recommended me doing that. So that is on my radar. I don't know. I'm still kind of figuring out. It all depends on once I'm done with school and where my life's at and whatnot, to get involved in that much more school. So we will see. But I hope you guys like this video. If you have any more questions that I may have not answered, I know there's tons and tons of questions. that, you know, maybe I can help you guys with if I didn't answer anything, or if I didn't answer it and didn't necessarily answer your question, let me know. Comment below. I would love to try and help any of you guys out who are looking into nursing. Yeah, and I will keep you guys updated on how my journey is going. I'm not quite done yet, so I can't wait to do a vlog or answer more questions once I'm done and once I pass the NCLEX and I'm an actual RN. I'm very excited, so lots of things to look forward to. Once again, thank you guys for watching, and don't forget to give this video a thumbs up and subscribe to my channel, and I will see you guys next time.